Continuing to discuss lithium, some of the side effects that a person can expect with a lithium drug is maybe a mild weight gain. They can be encouraged to maybe decrease their carbs and get increased exercise, and it shouldn't be a really big weight gain. They might notice they're more thirsty, and they should make sure they continue to drink. In response, they're going to have an increased urine output, but you don't want them to get dehydrated because that can lead to the risk of lithium toxicity. They might notice that their skin's a little bit more dry, so drinking and maybe using a kind of a lotion or cream can help with that. Adverse reactions can be changes in the thyroid, kidney problems, and diabetes insipidus, in which the person gets rid of a lot of water but keeps the solid particles that are found in urine, and that can be dangerous. Any suspicion of any kind of thyroid or kidney changes should be checked with the healthcare provider. These drugs don't interact well with diuretics, as you can imagine. Non-steroidal anti-inflammatory drugs, other antidepressants, and then antipsychotic drugs, and they can, cause various issues. Just make sure that the patient knows that levels over 1.5 milliequivalent per liter are toxic levels, and those risks of those side effects are going to continue. Greater than 3 milliequivalents per liter can cause the person to go into a coma. They can have multi-organ failure, and they can kill them. So they're going to need periodic lithium levels according to the healthcare provider. These can be discussed in the ATI book, pages 59 to 60. Let's talk about ADHD. This is not covered in the book, but I think it's a good idea to discuss ADD and ADHD because many of these drugs are taken by both children and adults. So you need to see what the ATI book says about it on pages 73 and 74. The characteristics of ADD and ADHD are pretty commonly discussed. The person has a hard time completing their tasks. They have difficulty paying attention, sitting still. They want to be moving all the time. Sometimes, especially in children, ADHD can lead to impulsive behavior. They'll do something extremely weird, and you're like, what in the world led them to do that? They just don't have control. They tend not to stop and say, is running out into the middle of the street a really good idea? And that can be a real problem for children. The person may have symptoms of anxiety, and their frustration and difficulty calming down and thinking things through may cause aggressive behavior. These kids can have sleep disturbances, just totally distractible. They're not always going to remember instructions, let alone follow them. Now, it's always been children that have been the focus of ADD, but remember that adults can be affected. And like all of these conditions we're talking about, it's thought to be related to just a problem or a difference in how the neurotransmitters send messages in the brain. Most of the medications for ADD are central nervous system stimulants. They take kind of the lazy little parts of the brain that are wandering and not paying attention, and they increase them, cause them to feel more alert, and help them to focus. And many times they will actually have a paradoxical effect and calm down neurotransmitters that are causing too much stimulation in the brain. Now, because they do all that, some of these central nervous system suppressants have potential for addiction. And now children and adults are encouraged to take drug holidays, weekends, vacations, summer break. Adverse effects are discussed on page 73 in the ATI book. It can decrease the appetite, cause weight loss. Growth can be suppressed, especially with some of the older central nervous system stimulants like Ritalin. And because they do have stimulating effects, they can stimulate epinephrine and norepinephrine. They can cause cardiovascular side effects. Strattera is a newer drug that is not considered to be a central nervous system stimulant, but it can cause GI side effects and, in severe cases, liver damage. So you want to watch for any signs and symptoms that could indicate hepatotoxicity. With the central nervous system stimulants, tell your patient to watch caffeine and cold medications, because these are stimulants as well. And these slides talk about common ADHD drugs, Ritalin being, or methylphenidate being the most famous, the one that's been around longer. So they say ADD, avoid caffeine, do not break, crush, or chew time-release tablets, and these help to release dopamine. ADD is generally the difficulty paying attention, but not showing the hyperactivity. Many females are more prone to this, and they kind of slide under the radar because they just kind of space out and don't pay attention. They tend not to be as hyper, whereas males many times will have a more hyper behavior and get more attention. And this is a newer ADHD drug, atomoxetine or Strattera, and a variety of side effects here. Mostly watch out for liver dysfunction. The last slide, or last couple of slides, concern drugs that can be given for substance abuse disorders. Once again, these are not covered in the textbook, but they are talked about on pages 83 to 88 of the ATI book. So I encourage you to read about these because you will see them again. Drugs that can assist with withdrawing from alcohol are the benzodiazepines. And the reason for those is that alcohol is a sedative. And if you are every day sedating your brain, when you finally go off it abruptly, your brain is going to be looking for that sedating effect. It's not going to find it, and you can all of a sudden be subject to seizures. So they want to kind of calm things down as the person is weaned off their alcohol. Disulfiram is a drug that is known as antabuse, and it does not cause changes in the brain to make the person want to stop drinking, but it affects the liver so that the person does not metabolize drugs the way they used to, and they can get deathly ill. And just the incentive of knowing they have a med on board that can cause illness sometimes is enough to keep them away from using alcohol. Many of the drugs that we'll talk about function somewhat like disulfiram, and if you drink alcohol while taking some of these meds, you get very sick. One of those is Flagyl, or metronidazole, which is an antibacterial, antifungal medication, and it has strong disulfiram effects. To help people withdraw from opioids, we have drugs like methadone. They sometimes use clonidine, which is a blood pressure drug, but it can be effective. And then buprenorphine, which is an opioid agonist-antagonist. It encourages some opioid actions while it cuts off others. So when you take the buprenorphine, that can sometimes help, especially when you combine it with naloxone or Narcan, which is an opioid blocker. And together they call those Suboxone. And of course, we all know the varying degrees of success that Suboxone can have. And then drugs for smoking cessation, bupropion, which I already talked about, or Wellbutrin, various patches and other nicotine replacements, and then a drug called varenicline or Chantix that is taken, and it sort of suppresses that nicotine drive. And it's meant to be roughly the same price as a month's worth of cigarettes if the person says that it's too expensive. So this is my last slide. If you need to quit one of these substances, there is lots of help out there. So make sure that you check out these PowerPoints, study them, hopefully you've listened to the lectures, and the test will be over Chapter 10 alone, once again, to kind of help with the complicated material.